the CMS guidelines regarding patient eligibility regarding chronic care management. This is just to clarify for everyone out there of who qualifies. Does my mom, dad, my loved one qualify for chronic care management? And this is right from the CMS website. And so they require to have two or more chronic conditions expected to last at least 12 months or until the patient's death, or that place them at significant risk of death or acute exacerbation or decompensation or functional decline. Still pretty subjective, but there are a lot of chronic conditions that are included to this definition. So it's very important to know if your loved one does qualify. And here are some of the examples that they list. This is not limited to this list, and the list is quite extensive, but this is to give you an example. Alzheimer's disease and related dementia. Dementia is a big bucket. I mean, there's mild cognitive disorder, there's Lewy body dementia, there's all sorts of different types of dementia. And so they kind of do this big bucket there. Arthritis, osteoarthritis, and rheumatoid arthritis. This is very common, especially osteoarthritis. And so, and that diagnosis is usually made off of clinical symptoms. It's a clinical diagnosis, as well as we use imaging, X-rays to kind of help us in making that diagnosis of osteoarthritis. Asthma, so regardless of severity, asthma, atrial fibrillation. So this could be paroxysmal, meaning it happened once after surgery, or it's permanent atrial fibrillation. They're always in atrial fibrillation. So obviously that would qualify. Autism spectrum disorders, cancer. What a huge big bucket here of cancer. So it could be cancer in remission or active cancer, obviously. And then also include basal cell cancer, squamous cell cancer of the skin. So remember those. Cardiovascular disease, what a huge bucket here. It's like, high blood pressure, high cholesterol, heart disease, known coronary artery disease, obviously congestive heart failure. These are all examples of cardiovascular disease. Peripheral vascular disease, so if there's clots in the arterial system, the legs, things like that, this would qualify. Narrowing of the arteries in some area of the body would qualify. COPD obviously would qualify regardless of the degree of the severity. Depression, depression and diabetes, controlled diabetes, uncontrolled diabetes. Obviously, this is a chronic condition. Hypertension we talked about. And then infectious diseases like HIV and AIDS. So again, this is not inclusive with infectious disease. Pretty broad topic here. So talk to your physician, talk to your practice if your loved one does qualify for chronic care management. Obviously, at Live Active Primary Care, our Medicare patients love the chronic care management. Once we educate them and let them know about it, it is wonderful, and it's a good way for Medicare to move towards a direct primary care because it gives us the ability to touch base with your loved one month to month. It doesn't have to be face to face. It could be through email, could be phone call, could be telemedicine, etc.